Hey guys, welcome back to Medical Coding with Blue. Today's episode is all about how to maintain your coding skills while working in risk adjustment. If you are brand new to my channel, welcome. I am Blue, I'm a medical coder. Okay guys, I got this message. This message inspired today's episode. So I'm going to read it, then we're going to get into it. So here we go. All right, so the viewer says, "Hi Blue, thank you for the guidance and idea of medical coding. I have a CPC certification and was initially doing same-day surgery and was unfortunately transitioned to risk adjustment, stayed for a year. Risk adjustment, if you don't know, is hierarchical condition category coding. This means that the person is just coding for diagnosis coding only. They are not doing procedure coding at all. No evaluation in management, no ICD-10 PCS, none of that stuff, okay? They're just doing the diagnosis coding. Within that year, I was able to have my apprenticeship removed. I watched this video to check how far behind, since we only handle ICD-10 CM in RA, and was assessing if I need to update my CPTs. We handled 2023 and applying 2024 ICD for October dates for the entire year. I wanted to update the CPTs since it was part of the CPC certification, and I'm worried that CPT is not part of our work, so I have no practice on it. I am planning to take a break from risk adjustment or resign to update the CPTs. Are there other certifications that could cater to CPT updates only coming from a CPC level?" I think what they're asking is if there are any jobs that only focus on CPT coding, not necessarily certifications, although I will address the certifications part. But first, if there are any jobs that just do procedure coding, first of all, you can't do that. Any coding is going to require, especially with procedures, is going to require a diagnosis. All procedures performed have to have a diagnosis in order for them to be billed. You cannot just bill a procedure code without a corresponding diagnosis. So it's always going to be that way. You always have to have those two together, okay? Risk adjustment is different because this is statistical and data collection, right? So the whole thing with risk adjustment coding or hierarchical condition category coding is that they want to be able to collect this information. Medicare was the one who started it, right? They collect this information about these patients. And these patients, there's a lot of conditions that if you have this condition, there's a good chance you'll also have this condition and this other condition and this other condition. And what happens is they can collect this data, right, from all these diagnoses that are being selected, and these are the patients, and it goes into an algorithm, and then they're able to decide, okay, this is how much it's going to cost us to continue to take care of these patients, to continue to be able to provide for their care. This is the projected amount that it's going to be. There's a lot of formula that goes into these numbers and figuring this stuff out, but it all starts with the coding. So that's why they started to do risk adjustment coding. As I said, Medicare started it. There are other insurances that now collect this data as well, because Medicare is the model for these insurance companies, because Medicare is all about saving the Medicare trust fund. So they have to be able to manage these funds into perpetuity. And the only way to do that is to be very mindful about where all this money goes. I'm going to leave that one right there. But I will say this. Again, insurance companies, they look at it, okay, this is something we need to do as well, because that way we can plan how much is it going to cost, so that way they can adjust the premiums and all the other rates and everything else. So with that said, that's why people, a lot of times when they're brand new and they're starting, okay, I can do diagnosis coding, and they get all excited. The thing that you don't understand, or what you may not know, is even though you're only doing diagnosis coding, you still have to understand pathophysiology. Pathophysiology, because that is the study of disease. You have to be able to know what symptoms go with what, and what goes with what, and all of these other things. And the only way you're going to know that is if you're really good with pathophysiology, which a lot of people are not when they very first start, because they don't know. And so they're working with an encoder, sure, but it's only part of the puzzle. You can't rely on artificial intelligence 100% of the way. Okay, you cannot. Everybody is unique. Everybody's medical history is unique. And there are very few people that have the exact same medical history as far as like medical history and risk factors and all of these things. So with that said, just understand that, all right? But there is no job that it is just CPT coding, because there has to be a corresponding diagnosis to go with it. And I have always said, if you're going to get into risk adjustment coding, let it be 4 months, no longer than 6 months. The reason that I say this is because what happens is there's a lot of people that will stop practicing for their procedure coding. You should not ever stop practicing procedure coding if you are in a risk adjustment role. Well, we don't do that at my facility. But do you still have the coding workbooks? You do, right? So if you do, then you have no excuse for not practicing on the weekend or in the evening, going through a chapter so that way it can still stay fresh in your mind how to look up procedure codes. Because sometimes these employers will say that if your only experience has been in risk adjustment coding, they do not count this as experience. So that's why I say to keep it short. Why do you keep it short between 4 and 6 months? Because this is a perfect time for you to just get your feet in the sand and moving around. Because when you are able to have this time there, you can learn about the electronic health record. You can learn about looking at the documentation and what does that look like. You can learn about all those things. Of course, you can learn about abstraction. Abstraction means selecting the diagnoses without it already being selected, okay? Because sometimes the diagnosis codes or the procedure codes are already selected based on what the provider has selected or based on what the computer-assisted coding has selected for the provider. And then when it goes to the coder, and you're looking at it, it is up to you to make sure that that is the most specific code, which 95% of the time it is not the most specific code. And then you have to make sure that, all these other things, the sequencing and everything else is correct. So looking at all of those factors when you're in these records, that's the whole practice part of it all. And so that you get a good, okay, I'm getting a good understanding. And then you could take that experience and say, I've been here 4 months, I've been here 6 months. I would like to start clinic coding, and this is the experience that I have with the electronic health record. And if you are getting experience with like eClinicalWorks or Cerner or Epic, this looks great on your resume, okay? Even though they say that, of course, they want coders to have 1,000 years of experience. And how are you supposed to get experience if no one will hire you? Well, guys, they need you to have some experience. Having 3 to 5 years of experience is a desire of theirs. It is preferred. Preferred does not mean required. Sometimes they'll get sneaky and they'll say, 3 to 5 years of experience is required. I will ask you this in turn. Is there a charge for you to apply for this job? Absolutely not. You should never be charged to apply for a job. There's nothing wrong with submitting a really good resume in to this organization that's looking for coders, because guess what? If there are happy coders in that area, they will not move. And so that organization will have to select whoever is applying. And if you had the gumption enough to apply and tell them on your resume what you were trained in the school, then you may have a chance of getting a call back. And if you get one of those immediate rejections from the internet that says, thank you for your resume, but we want this and we want that and blah, 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 then you mail it in. You mail in a copy of your resume. And for those of you that have to be told, somebody asked me, well, I don't have access to a printer. The public library often has printing services there, right? You can go borrow a computer and then you print out and they charge you maybe 10 cents or a quarter, whatever. You can go to the UPS store. UPS store also has printing services. They may charge you a few cents as well, okay? But that's what you got to do, all right? So even though you don't have a printer, it's still not an excuse. We've got to start problem solving, folks. Start problem solving. But that's how you get around that. But again, how do we keep up with our skill if that's all we've been doing is just the risk adjustment coding? And, we haven't had any exposure to CPTs. Again, it's not an excuse. When you have your coding workbooks with you, you can be practicing on the weekend. It does not have to be as strenuous as 20 hours. It could be 10 hours. Okay? If you already have your certification, you're working a risk adjustment coding job during the day, all you need to do is start practicing on the weekend, okay? Or in the evening when you have some downtime, all right? And it doesn't take long. You do your workbook for 30 minutes, you do your workbook for 1 hour, and then you stop and you give yourself a break. Don't go past 1 hour. When I see these people, they get so gung-ho and they're like, oh no, I'm going to do all these 6 hours per day and blah, blah, blah. You're going to burn yourself right the heck out. You're going to burn yourself out, and then, then where you're going to be. The slow way is the fast way. Thank you, Rick, on his channel, Think Like a Horse. It has nothing to do with coding, but he says things that are common sense. He was in the military. He taught adults. So he knows that if you learn slowly, you will be fast. If you try to learn fast and cut corners, it's going to show you're going to be struggling the whole way. Okay? So if you find yourself in this position where you're only doing diagnosis coding, you have no one to blame but yourself if you stop practicing, guys. No one to blame but yourself. And yes, I'm going to tell y'all just the way it is, because that's how I am. Because you know what? A lot of y'all need it. A lot of y'all do need it. And you know what? Get upset. Good. Get upset. Let that drive you. Let you say, okay, well, I'm going to prove you wrong and I'm going to do this. Good. Do it. Do it. Practice. Practice. Spend that time studying. Work through the workbook. Look through the CPT manual. Read those notes. You have a job right now, right? Risk adjustment coding. You have a job. There is no pressure for you right now. So while you're doing that, in the evening, look at your CPT book. Read those notes in between. Read the guidelines for evaluation and management. Read the guidelines for the surgical guidelines. Go to the CMS, go to the Medicare Learning Network, and you can see the booklet for the Global Surgical Booklet. And it's going to give you all of the information for free about global packages and what does it mean for surgeries. Okay, that's another resource that's out there, y'all, that you can access for free. And I know I'm going to get 100 emails. Oh, where's the website? Where's the website? CMS. It is the Medicare Learning Network. You can Google Medicare Learning Network and it will bring you all of the links that are there. But you're looking for the Global Surgical Booklet, okay? And it will tell you all of the things about what 0 to 10 day global means, what that means, what a 90-day global period means, what the XXX, YYY, what all of those things mean, those weird things that are in CPT. It will explain that as well, okay? It will explain everything that's all included in that, all right? And if you watched my live on Thursday last week, and it's out there, I put the study tips on it. You can search through my videos. But if you had watched it, you saw that I had recommended Optum, the Evaluation and Management Coding Advisor. That's a workbook that you can use to help you to learn about evaluation and management if that is something that frightens you, which it happens to a lot of people because it's not really covered in a lot of these programs for coding. And if it is covered in the program, the person who's doing the teaching sometimes is rushing through. Not always, but the vast majority, and if you happen to have a really good instructor, then you were very lucky because not a lot of people get a good instructor. When I was in coding school, the coding school is no longer there, don't ask me. But when I was in the coding school, they gave us a book and I read that book cover to cover. Now they did give us a syllabus to say, read this section, this section, this section, this section, so that you can get out in this many weeks and blah, blah, blah. I did not do that. I did not listen when they said to read only these sections because I was pulled aside before I got into evaluation and management. And they told me, Bleu, you're doing really good. You're making really good timing through your program. But here's where a lot of people hit a wall. And this is the part where people start to quit. So we don't want that to happen to you. And I was like, okay, what's up with this, And they go, this is evaluation and management. This is one of the hard parts. Because it's difficult to understand, and it's difficult if you don't have somebody to explain it to you. Now, they said we do have an instructor here who will be here to help to answer your questions. I didn't like the guy. He was very creepy. I don't like that guy at all, okay? And yes, I did that because of how creepy this guy was, okay, at the time. And I didn't like it. I didn't like him. I didn't like his attitude. I didn't like anything about him. Stay away from me. So I did not go to his classes. The only thing that I could do was to read that book cover to cover. And that's exactly what I did. And when I was in school, right, because I could be there during the day, whatever time I wanted to be, and people would see me reading the book, they go, why are you reading it? They didn't tell us that we needed to read all of that. You're just wasting time. And I said, this is not wasting time. This is ensuring that I'm going to know everything about evaluation and management so that I can make it through this course the first time. They go, well, Bleu, that's not fair. And I go, well, I mean, I am this way. I will read. If it's going to take me a little bit longer to read, that's okay. But I'm going to get through everything because that's the only way I'm going to be able to understand. And because of that, I have never really struggled with E&M at all. I am very good with E&M because of that. And like I say, if you get that book from Optum, if you go to the Optum Coding website, optumcoding.com, not an ad, but I'm just letting you guys know that the link is in the description box below. But if you go there and you find the Evaluation and Management Coding Advisor, it's a really great price. I'm not going to check it right now because I'm going to start looking at all the books. But if you go and you get that book will help you. If you read it from cover to cover, it will help you to understand. There are questions throughout that book. It is a great and comprehensive book in order to help you to learn evaluation and management. And like I said, guys, if you are out there and you are trying to learn and you're still learning on your own, you are going to learn this stuff, but you just need somebody to explain it to you. It's no harm in hiring a tutor or finding a mentor. A mentor will help you for free. And if you go on LinkedIn, you can ask a question. Maybe that will get somebody to respond to you. But if you need to hire a tutor, guys, there's tons of tutors out there. You can even ask for recommendations on LinkedIn for tutoring. And I am a tutor myself. My rate and contact information is in the description box below, guys. Look at the description box. It has my contact information there. I do 1 hour Zoom sessions and it is just me and you. All right. And there's nobody else. So that way we can concentrate on your specific question. So that's what I have to say there. But yes, guys, continue to practice with those workbooks, even if you're out of school, even if you're in a risk adjustment coding position, and you can continue to apply for jobs even while you're working. Okay, so continue to apply for those jobs, because as you got that one job, you will be able to get another job, and you never ever fear those procedure codes, because if you do, then you're just going to stay stuck. And that's just my advice anyway. So with that said, I'm going to wrap this one up. Thank you guys so much for joining me. If this video helped you, please like, subscribe, and share, and I'll see y'all again. Bye.